Yeah.
Hi, my name is Tiffany Thomas. I will be your nurse for today. I'm going to close my privacy curtain. Can I get your complete name and birthday? And I'm washing my hands.
Michael Thomas, 91489.
I will be looking at his armband. Well, your doctor day has ordered a couple of assessments. As I'm walking up on him, I'm looking at him. He is well groomed, hair is neat. Next, I will be asking, have you had any head trauma in the last couple of days? Okay, so I'm going. Yeah, I touch you.
Mm-hmm.
I'm coming up. He said he didn't have no head trauma. Can you tell me where you're at?
Nevis.
Can you tell me the reason why you're here?
Headache.
Can you tell me what year it is?
2020.
So my patient is alert, oriented, and identify and to person, place, situation, and time. So that's times 3. I'm gonna come up to his head. I'm gonna palpate and feel for some bumps or bruises. I'm looking at his scalp and his hair, and it is to his efficacy, directly even. Next, I will be asking, have you had any problem with your eyes, your ears, your nose, your mouth, or your throat?
Sore throat.
Okay. So next, I'll be looking at his ears. They're symmetrical. They're no drainage. Do you wear any hearing aids?
No.
Okay, I'll be looking towards his eyes. Do you wear glasses?
Yes.
Next, I will be looking at his pupil.
Pretty good.
That's fine. Let me see if it's right there. I light. Yep. His scrotum is white. His pupils are reacted to light, and his eyes are 4. Now I'm gonna do accommodation. Can you look to the TV?
Mm-hmm.
And then to the pen. So it is accommodated. So I'm looking in the middle of his face, his nose, his mouth, his throat, and his esophagus is lateral. Are you having a hard time using your nose, basically?
Yeah.
Okay, can you pace and see? Can you put one hand in front of one nostril and blow, and then the next? And the next. Then I'm gonna look at inside his mouth. His lips are wet and moist and pink. And outside, his tongue is pink. His dentures, not dentures, his teeth, clean and clear. His mucous membranes is wet and moist. Okay, next I will be palpating his lymph nodes to see if they're swollen. No swelling. Have you had any stiffness?
No.
In your neck? Okay, next I'll be looking at his JV to see if you have any dissent. Go on that side. Now, next, while I'm still up here, I'm gonna test his elastic. Take his hand, I'm gonna pinch his skin, and it's returned. Next, I will his skin, his hair is evenly distributed, his pigmentation and his color is within its ethnicity. He's warm to the touch. Next, I will palpate his fingers, his capillary. His fingers are within his race. Hell, I'm saying that. It's within the race. His capillary flow is less than 2. He has no color. Has his color of his race, and as well as no clubbing. Next, I will be doing his. Next, I'll be checking his pulses. His chorionic is up here. His brachial is within his arms. His radial, they are 2+. His popliteal, his dorsus pedis is 2+. His posterior tibial is 2+. Next, I'll be checking for edema. I'll do distal. Next, I'll be checking his lobe. Well, I'm gonna stay in the second intercostal space. Check his aortic, pulmonic, his Erb's pump, tricuspid valve, and his mitral valve. And if I was listening, his S1 and S2 will be with my bell. If he had an S3 or S4, I would be using my bell to hear a lower sound. Have you been having any chest problems? Next I'll be assessing his respiratory. But right now, I'll be looking at your shirt to see how well you breathe in and out. I will do that for his rate is at 18. He is not shallow. He's unlabored. Next, I will be checking his lobes. I'll be in the upper right, upper left, middle right, lower left, and lower right. Breathe in. Next, I'll be checking him laterally. Can you cross your hand? Breathe in. Next, I'll check the other laterally. Right laterally. Breathe in. Next, I will be checking his posterior. I'm going to go upper right. Breathe in. Cross your hand. Breathe in. Upper left. Breathe in. Lower left. Breathe in. Lower right. After that, I will be teaching you cough, deep breathing, and to use your suspended thermometer. I also have to teach you about the Glasgow scale. The Glasgow scale is a test we use to monitor your neurological. So I mean, you did pass it because it's mostly the three topics that it mostly have is vision, motor, and hearing. So I mean, visualizing, you looking at me. Motor, you're reacting to everything I'm saying. Hearing, you're actually hearing everything I'm saying. The Brady scale is mobility, nutrition, and shear. And the Brady scale is mostly consistent of skin breakdown. Next, I will be teaching you about the cough turn deep breathing. It's used to help you avoid pneumonia. So you just turn your head, breathe in, and cough. And then you do the same way. Breathe in, cough. That just helps you to clear your lungs from pneumonia. But it's and you do that every 2 hours. The thermometer, I will give you a goal to breathe in, and then you go up to your goal and you do that 10 times every hour or every other commercial.
10 times every hour or every other commercial.
Yeah. Next, I will be doing. The GI. I will inspect first. Got scars, your hair is evenly distributed. Nothing wrong with your business. Next, I'll auscultate. I'll start in the lower right quadrant. Upper right quadrant. Upper left quadrant. floor. Okay. And for me to I'll go to the Brewy. I turn it on my bell side if I want to assess the AAA, and that's what I use my bell for. So I place it there and hold it for a minute to assess for a Brewy. Then I palpate. Have you been having any kind of bowel movement problems?
No.
When the last time have you passed gas or did a bowel movement?
As soon as I laid back,
Okay,
laid back and forth.
next, sit up. I'm going to check for edema in your leg. No edema. Next, I'll have you to stand up. Have you having trouble with mobility? Next, I'll be assessing your range of motion and strength. Range of motion and I will be holding his joint. When I say flex, then stand. Flex, stand. Flex, stand. Flex, stand. Okay. When I do the one side, I do the other. When I say flex, stand. Flex, stand. Flex, stand. Okay. Next, my second upper. When I say hyperflex, extend. Flex, extend. Hyper, extend. Flex, extend. When I say adduction, abduction. Adduction, abduction. Adduction, abduction. Okay. Flex, hyperextend, extension. Flex, extend, hyperextend. Flex, hyperextend. Abduction, adduction. Abduction, adduction. I forgot to do the side. Hyperextend. Flex. Okay. Next, I'm gonna do. I guess you sit down for one second. I gotta do that. Next. Next, you extend. Flexion. Flexion. I'm checking for crepitus. Extend. I feel it. Correction. Flexion. Extend. You feel it, babe? You got cryptus. The cracking.
I'm against.
Flexion. Extend. Flexion. Extend. Flexion. Flex. Extend. Flexion. Extend. You got crepitus. Next, your legs popping, your knees popping. I know you got crepitus. I know, yeah. Okay, next we're gonna do your feet. This is plantar. You lift your dorsal flexion is up. Plantar is the pointed toe. I'm gonna hold. Ow!
I'm sorry, you never
Okay,
did.
come on now. Oh, you do too much. Plantar flexion. Points. Dorsal flexion. Plantar flexion. Dorsal flexion. Plantar flexion. Dorsal flexion. flexion. Plantar flexion. Dorsal flexion. Plantar flexion. Okay. Next, we'll be doing gaits and rumpus. Now you can walk. Walk. Watching.
Wait.
Just walk. Just checking your gaits and balances. Cover that. Okay. And then next, check your rumba. Close your eyes. No swaying. Okay. And are you having difficulty peeing?
Peeing?
That includes my video. If I miss anything out, please comment. Thank you.